Ram here has sustained an anterior cruciate ligament tear whilst competing in BJJ or sparring in BJJ. Ram was in a 50-50 guard at the time. His knee was locked up, but he tried to escape it and he sustained a rotational trauma to the knee. History of cartilage damage to this knee as well. Now, what we can see is there's a lot of swelling in the knee, there's weakness, especially in resisted hamstring contraction, so resisted knee flexion. Now, it's a little bit far-fetched to say that through osteopathic treatment we can improve how quickly the ligament can heal via treating the ligament, but what we can do is definitely put it in a much better environment. So with this amount of swelling on the knee and with the weakness of the surrounding muscles, the knee's not going to be getting full, healthy articulation, so that you could say that fluid health is going to reduce in the knee. But as well as this, with the wasting of the quadricep muscles, the hamstrings, and protective posture going inside the knee, that if Ram were to go into BJJ, say as soon as his knee's recovered, then he might be susceptible to sustaining certain injuries, strains, re-damaging the ligaments, supporting ligaments, especially the hamstrings. So what our role as an osteopath is to do is to try and put the knee in a much better environment. That means reducing the swelling, managing healing, and making sure that the quadriceps, hamstrings, and any mechanically related areas are functioning as best they can at that time of healing. So what we're going to do today is drain the swelling or pump the swelling out of the knee, make sure that there aren't any areas of the quadriceps and the hamstrings that are causing Ram too much trouble, and then we'll compare before and after.
So here you'll see me massaging the quadricep muscles, and this is really just to desensitize any discomfort that Ram's getting in the quadricep muscles that might be preventing him from fully flexing or fully straightening his knee. Then move on to some quite gentle articulation of the knee. Once again, a lot of the treatment in the early stages of rehab is literally just to pump any swelling out of the knee and to desensitize any discomfort that the patient's getting. So here you'll see me putting a little bit of traction through the knee and then very gently taking it through the ranges of motion. It's a little bit hard for the patient to do this themselves because they might have quite poor confidence in using the knee immediately after surgery. After that, we can be a little bit more aggressive with the articulation by placing my arm in between the gap between in the crease of his knee. We can actually create a little bit more distraction throughout the knee and a little bit more of a shift in the knee joint itself. And then really, once the patient feels like their knee's a lot more comfortable, this is the most important part, which is taking them through exercises which they can progress on a daily basis. During ACL repair, the surgeon can take a piece of the hamstring tendon to repair the anterior cruciate ligament, so the hamstrings are left quite weak and possibly underused. By stimulating the hamstrings, contracting the hamstrings in a pain-free range of motion, we can start to get the patient to strengthen the hamstrings as well as improve their confidence and function within the knee. The most important part is to work within a pain-free range of motion, so you don't want that patient moving against a painful barrier, at least in the early stages. And we could do exactly the same with the quadriceps, performing isometrically to ensure that as little inflammation is generated as possible. And this is a before and after picture, so you see that we've got around about 20 to 30 degrees increase in knee flexion after the treatment. And it might seem small, but for 2 weeks after surgery, it's actually pretty good progress. From here, Ram can continue to develop his strength and the functioning of the knee, as opposed to bed rest, where, as explained before, he might completely rest his knee, go into exercise, and then re-injure his hamstrings or any ligaments within the knee. So rehabilitation needs to be progressive and slow to have maximum effects.